Okay, Jane. Well, welcome to today's League of Women Voters of Colorado Justice, Equity, Diversity, and Inclusion Task Force meeting. Today, our speaker is Laura Elena Porras, and her company is called Doctors Care. It's a company that provides affordable and accessible health care. It's a nonprofit. Laura Elena brings a wealth of knowledge to doctors' care via her bachelor's in sociology and master's in public health. She ensures the organization's um, current events, the organization is current on events and how legislators on both the state and federal levels affect daily operations. As a coverage director, Laura Lena oversees the Connections program, which helps individuals navigate the health insurance landscape, enroll in plans, and educate on insurance benefits. So tonight we're going to do something a little different. We're going to solve a problem. We'll have a case study. A situation will be presented, and the question will be whether someone on Medicare should take a new job that offers a substantial increase in pay. So I'll turn it over to Laura Lena, and she'll see how far we can stretch a dollar. Thank you, Laura Lena.
Thank you, Kathy. Hello, everyone. Thank you for having me today. Yeah, as Kathy alluded, we are going to be talking about how far you can stretch a dollar to access healthcare. So, to start off, I want to introduce a little bit more of our organization. So, Doctors Care is a community safety net clinic serving Littleton for over 35 years now, but we offer primary care, reproductive health, and behavioral health services. We have care coordinators who help patients access additional medical services, like specialized care or even other navigation services as needed. And for our clinical services, we accept patients ages 0 to 50. And if you have, we'll accept health insurance through Medicaid, CHP, Anthem, or Cigna. And if the patient does not have health insurance, a copay based on income and household size is offered. That can range from between $15 to $100 per visit. And then we also have our coverage program, which is a program that I oversee, which is equipped with certified health coverage specialists available who help with health coverage applications. So we're basically going to bring you into one of the many scenarios that our clients face whenever they're having conversations with our coverage program. Our role is to help patients and community members. So we'll work with the community as, you know, if people want to book appointments with us, they can book appointments and come into our clinic. But we also scrub the clinic schedule to make sure that those uninsured folks are also getting access to any of the benefits that we might help with. So we help patients and community members obtain and maintain health insurance. We'll also provide health insurance education, and all of our services are free and confidential and one-on-one. We support clients with applications for Medicaid and CHP and the Connect for Health Colorado Insurance Marketplace. So we'll help educate people on how the tax credit program works, and how their income should be reported and how that impacts, you know, the eligibility that is that they might be eligible for. We do not determine eligibility, but we guide them step by step based on the information that is provided. So based on the income that is provided, then we'll say, okay, it looks like you might qualify for Medicaid, so let's go ahead and submit an application to the county so that they can verify your eligibility, and then the application itself goes directly to that county. So that's just an example. So now that you have kind of an idea of how our services could work with somebody, let's go ahead and introduce Sarah. So here's some basic information, but I'm also going to read it out loud. Sarah has been a single mom for several years. Unfortunately, relatives live quite far from Colorado. Sarah has filed papers with the state of Colorado in an attempt to gain child support, but so far the children's father has not been located. Sarah works full-time, 40 hours per week at a small trucking company. She does not have employer-sponsored health insurance, and each year her employer gives her 5 days of sick leave and she earns 5 days of vacation leave. Her boss has been kind when she has had to use it to care for sick kids and attend school events. If she needs more time, she's able to take the hours without pay. Her son, age 7, has been diagnosed with asthma and he tends to fall ill more than average. Her daughter, age 13, is struggling with situational depression and is better when she sees a counselor at least twice a month. Sarah also benefits from regular counseling. Sarah works Monday through Friday, 9 a.m. to 5 p.m. with a paid lunch break. Her supervisor allows her to extend her lunch occasionally to attend appointments as long as she makes up the time. Sarah lives in an apartment within 9 blocks of the children's school, um, which is about half a mile from a bus route, and 5 miles from her job. She likes her job and believes she has opportunity to move up in the near future. The office manager has announced her retirement, leaving an opening. Sarah's highest priority is keeping her family housed in Littleton. She has a two-bedroom apartment that costs 15,000 or sorry, 1,500 without utilities, Wi-Fi, or cable. Though her daughter is able to help with babysitting, Sarah still must spend $200 a month for after-school care. So just some things to kind of be thinking about, right? Um, so that's Sarah and some of the things that she needs to be thinking about. Right now, with the income that we're working with for Sarah, um, her income for Medicaid to maintain her coverage for Medicaid would be $3,154 per month. And I'm sorry, I might have messed up those numbers actually. But the current income that she has is there we go. Okay. So the current income that she has is 1442 um or 1481 and it has increased a little bit in between the 2 years that she had been working in that company. But if she does take that raise, then she is okay, so this is what I was referring to. So then she would be qualified for um for CHP because then the income limit for a family of three is 3,154 per month. However, if she does increase that pay, then she would lose Medicaid. So now we need to figure out what happens once she loses that Medicaid coverage for her children, right? So the future situation would be the new manager position is $18 per hour with 40 hours per week. Um, that brings her to a monthly of 3,240. So again, she is $100 over the monthly income that she is allowed to have under Medicaid. And her highest priority is again staying in Littleton, balancing her rent, utilities, food, daycare, transportation, and healthcare. Her daughter helps with babysitting, but again, those after school care is still needed. And so those are you still have to account for the $200 that she has to pay for healthcare or for childcare, right? And so when looking at this and then looking at the potential change that could happen, Sarah and her children would no longer qualify for benefits on Medicaid. However, the children would then transfer over to Child Health Plan Plus, so CHP Plus, which is another state program that is available when parents are making too much money, but then they can't afford to have their children on their private insurance through their employer. So then they still make enough money or low enough income to maintain that government program for the children's coverage. And so the children would maintain coverage. Now we would just have to worry about the access to Sarah's health care. So if Sarah were to take this job, children go on to CHP, Sarah would need to purchase health insurance. Sarah qualifies for an advanced premium tax credit from the Connect for Health Colorado marketplace. Um, and so based on the benefits and based on the income and based on the household size, just like how it would be on Medicaid, there's also eligibility for financial assistance on the marketplace. The assistance on the marketplace allows us to pick from two different plans, two different examples that we've set for you all. She can choose to pay for a bronze health plan that is $1 a month with the assistance that she's receiving of $463.90 a month in that income. And she would still have to make sure that she is accounting for a deductible of $5,650 of medical services that she has to pay up front before the insurance kicks in. If, however, she's willing to pay $21 a month, then she would now be offered a silver plan. And a silver plan, because of the income that Sarah is under, she also qualifies for what's called cost sharing reductions. And cost sharing reductions can actually lower the deductible itself. So in that bronze plan, you see a $5,000 deductible. In this other plan, you see a $100 deductible, which is incredibly lower, meaning that she has to pay up front only $100 for any of the care that includes lab, hospital, or specialty care. She would still have to make sure that she has set aside a total of $1,375 for out-of-pocket medical costs. So that's the total medical costs that she would have under that plan. Or she could decide to go uncovered, no coverage, and just take the full risk of just hoping that she's healthy in this year of 2026. Now, now that we have seen the activity and kind of broken down how Sarah would be, handling her decision to actually purchase coverage. Let's think about this for a little bit. If Sarah takes a job at $18 an hour, she will use 15 sections for rent. That's for the 1,500. And then she would have to make sure that utilities include $200, so two sections will be colored in, six sections for food, and then half a section for basic cell service, etc. So what I would like for you all to do is, if you're able to use this to kind of really set up a budget so that we can decide what is the best decision for Sarah to purchase a plan on the marketplace. Is it better for her to have a $1 a month plan? Or is it better for her to choose a $21 a month plan? Now, the other thing to also remember is that Sarah is also making sure that she is able to go to counseling. And the access to counseling could potentially be different between a bronze plan and a silver plan. So, how do we also make sure that she has access to healthcare? So, the bronze plan includes one free well visit and three sick visits, each for $50. And then the balance of her cares is subject to the full deductible. Whereas a silver plan, it includes one free well visit and then unlimited sick care at a $10 per visit. And then we know that behavioral health visits are $50 per visit under the silver plan. Whereas the bronze plan, she's going to have to pay out of pocket full cost before the benefits can kick in. And so those are some of the challenges that she will now be facing. And to decide that, we really got to look at how can we actually stretch that dollar so that we can also add that additional fee of $21 a month or $1 a month, right? Um, to give her access to healthcare. Now, one thing that I will say is I will assign, how many people do we have on the call today? 9 participants.
We
So
have
I
nine
guess,
on the call, including the two of us.
okay. So I wonder if it might be better, Kathy, to have a discussion more of looking at the wild cards
Yeah, go
individually
ahead.
rather than going into break rooms, just because
Yeah,
it's
I
a
think
smaller
that'd be better.
crowd.
Hmm.
Um, yeah, so I think that would be great. So what we're gonna do is basically talk through each one of these wild cards. And I would like for you all to just come off mute and um, just kind of open up the discussion to see if, in the case that Sarah were struggling with a substance use disorder, but currently receives counseling at no cost through Medicaid, what would be the change now, and what would be the choice for her to make to be able to access mental health care at an affordable rate, right? Um, but also making sure that we stretch that dollar. So let's look at the first scenario. What would be the best choice for her?
So her set costs are 1,700 2350. Is that right?
Yes, that is correct. Around 2350. With what is
Um,
included on here. So
and then her new income is 3240.
that is correct. 3240. So she's at 3240 and there is 1500 plus 200.
Well, I think she
So
would be better on the silver plan because she doesn't have much of a deductible for the counseling visit. I mean,
Right, I agree,
mhm.
but I haven't done the math.
Yeah. So, and I think one of the important things to also account for is if you're doing that math of like, okay, so after all of those utilities and all of those bills, um, she's left with $740. And so those $740 need to stretch to where we're also accounting for $21 monthly for the bronze plan. And then also we had
For the
said it's
silver plan.
$50 for the silver plan, correct? And then if she's gonna go to counseling for substance use disorder, then we would also account for at least $50 a month as well that she needs to make sure to have available. So 740 left, and then take off 21 for that monthly cost, and then take out 50. So she would still be able to have $669 left over,
wait a minute, I'm
which
confused because I thought you said she had 33240 and her set expenses were 2350. So are you adding the $50 there to make it 2400?
yes. So what I'm doing is adding, okay, so the set bills that we already have are the 1500 plus the 200 that I listed on here, plus the 50 for basic cell service, plus the 600 for food for entire family. And then car insurance, gas and cost, that's 150. So that's 2500 in that just includes that I haven't added the health insurance cost because we're still deciding which one we want to go for. So
Okay.
that's 2500. So then I did 3240 minus 2500. That's 740 that's left over. So then, okay, so how much money would she be able to save if she did a silver plan? Then in that case, she's paying $21, so we have to take those $21 out of the 740. And then we also reduce the $50 per visit. Let's assume that she's doing a visit per month, then we have to account for $50 per month that she also has to make sure that she has included on there, right?
Mm-hmm.
And so now she has $669 left over that she can
Okay.
save. So
Okay.
that's the first situation, right? So let's just kind of remember the 740 that are left over.
Can I just jump in here? So
Mhm.
you're not accommodating or thinking about the money that she might have to have in reserve for her deductible, right?
Correct. Thank you. I appreciate you bringing that up. I think it's also good to just kind of account for that as well as making sure that she's setting aside um it's $100 for the full year, right? So at least making sure that she has that set aside. And we can divide that in by 12 if we want to do that as well, if we want to get very accurate about it. But she has to make sure that she accounts for that as well. And it will vary because if we choose a bronze plan, then she would have to make sure that she accounted for all the services that she's going to have to pay out of pocket that include that what was the deductible? $5,650 deductible. So she would have to account for that depending on the services. So say she's getting any labs and the lab was $100, then she has to now deduct that $100 from that month that she had that service, right? So any services that include that lab, hospital or specialty care. So yes, thank you for bringing that up. At first, it's very easy to say, okay, there's $600 left over, but we're only accounting for behavioral health care, and we're not accounting for any of the sick visits that she might potentially need. We're also not accounting for any of the additional needs that the kids might have. You're stretching that a little too thin, even though it feels like, you might have those $600. That's still not enough to like even have like a savings account. Very tight. What if there was car trouble? Car tires are bald and unsafe. Oops, unexpected expense. How many of us have gotten into those situations where one emergency sets you behind on mortgage, on rent, on something, on a bill? And what's the first thing that we sacrifice is our healthcare. And usually, unfortunately, if you don't pay that month's bill, especially if it's your first month, which is that binding payment, if you don't make that binding payment, you will lose health coverage for the full year. So let's hope that she didn't lose her tires in the time that she was also supposed to save up those $21 to make sure that she had that premium paid, right? There are situations like that can happen, that can maybe sacrifice that month's coverage, right? And in the time of the first month of coverage, it could sacrifice the full year where that person could just no longer have coverage. Let me go back. And then we have our golden ticket. If Sarah were to receive a voucher for reduced priced housing, cutting her rent in half, how comfortable would you feel now selecting either a bronze or a silver plan? So at that point, we're now reducing housing, which is that $1,500.
Well, I think that the silver still makes sense because the deductible is so much lower. So she just could build a better cushion, right?
Right, exactly. Exactly. So that's kind of the other thing too, is that she might have more of an opportunity now that she has a lot more money to save, and she can even start a savings account where she can start building an emergency account. So you can see how, slowly thinking about this, there's only certain ways that you can get around, actually being able to budget for not day-to-day survival, but really for room for growth, for financial growth. Something has to fall out of the sky, right? Even with when we looked at the substance use disorder support, even when we're budgeting, there's only $600 left. And that's very little when you have two kids and you also have maintenance on your car and things like that that might come up, right? And this golden ticket is amazing, but these things don't happen very often. What about we reduce the child care, and now we don't have to spend $200 on that at no cost in exchange for chores and shopping. So What if that were the case?
Same issue still. It's silver plan. I mean,
We would
it's
do a silver plan.
savings, but
I mean, that deductible is just a lot to make up, and it's only for nine or $20 a month. I mean,
right.
Hmm. Yeah, absolutely. I think that's very, very helpful to just kind of look at, um, is the importance of really understanding the difference in deductible. And sometimes people go into these plans thinking, oh, it's only $1 a month. It's a lot more beneficial for me in the moment, right? But they're not actually looking at, this is going to get me access. If I do a silver plan and I know I'm going to the doctor a lot more often and I'm having to get labs, hospital and specialty care. In Sarah's case, it's not very necessary. In that case, what if she was willing to sacrifice that? How would you all feel about that?
I think you
Exactly.
just really have to live with the situation, whether you could spare $20 a month or $21 a
Hmm.
month or not. I mean, there are a lot of expenses for having kids, and I don't know. I think you have to make a judgment call.
And
Right.
maybe it depends on her age and her past health if she's got issues that she know might come up.
Exactly. Yeah. I think that's always very important to just kind of think about is that usually in a client's head, they look at the monthly cost versus the deductible and the out-of-pocket max because they're thinking, how can I have health access to healthcare at an affordable rate? Um, they're usually going to go for that $1 a month, right? Just because they're trying to make sure that they have access to as much money as possible because it's a lot less, right?
I think the
And
other
so,
consideration is that she's the sole breadwinner of the family. If the father's not supporting them, what happens if she gets sick?
right, I think that's a
Hmm.
great point too, is also just understanding and noting that in many of the cases of many of these families that we work with, it's that sacrifice of, if there's no access to any healthcare, then there's all right, well then there's no work, right? Um, yeah, that's a great
Well,
point.
I've got a general question.
Go ahead.
Are you assuming that all this is sort of in network, that there's not total cost and covered cost and all that kind of jazz that you usually get into?
Mm-hmm. Mm-hmm. Yeah, that's a good question. What if she gets into a situation where she accidentally went to the wrong behavioral health provider and now she's stuck with a bill that she has to pay because she didn't get the right provider. Um, that's also something to also consider once you start doing, making sure that you are working with a provider that is part of your network because that can impact the cost of your care as well. So this is assuming that Sarah is properly budgeting based on what her plan includes.
Okay.
So are these set plans, or is this a hypothetical plan?
Yes, so these are actually set plans, and I can actually kind of walk you all through. This might actually be very helpful to show. Are you all able to see my navigation at this point?
Yeah.
Okay. So this is the website that we'll use whenever we're working with a client. Um, the easiest way to actually estimate your own savings is actually going on here and just playing around with the website. I think this is really cool. So essentially what I do is I kind of work through and give a scenario. So let's assume that mom is, or we can even just put Sarah. And none of this information is ever saved, just so you all know. This is something that's just used for people to just kind of play around with. And so son, I believe, was 7, and then daughter is 13. They do not need coverage, but this is just you have to include the family size on here, the composition, so that the calculator is able to give you a better estimate of the tax credit that you would receive that would help cover the monthly cost of your premium. So that's the benefit of applying on Connect for Health Colorado, is that you're actually able to purchase at a lower rate because the premium is covered by the government partially, depending on your income. And so on here, we said her income was going to be set at 3240 on a
So
basis.
this is a different tax credit than the one that they're fighting over now? Or is it the same?
This is the same tax credits, but what they did is that they actually cut them. So what you'll notice now on the website, and this is new, but I only put the federal tax credit. So the federal tax credit is severely cut. And so because it was cut at the federal level, the state was able to come in and say, okay, we're adding a new benefit of at least $80 per month that the state will help cover for the premium costs. The other thing that I had mentioned earlier is because of Sarah's income level, she's still low enough to where she still qualifies for what is called cost sharing reductions, which can lower her out-of-pocket cost for covered services when she chooses a silver plan. And then conveniently, you can also, look for doctors on here, but sometimes I always recommend that people also verify with the provider directly if their plan is accepted. Now, here are some a little bit more expensive plans. So those were some of the some of the other plans that we had examples of. But the bronze plan that we were talking about, even though it's a $1 plan because you're receiving all of this tax credit, that deductible is just very high. And when you actually look at the plan details, it's very important to also really understand that primary care to treat an illness will be available, but at a $50 per visit. And then after those 2 visits, then you have to pay a coinsurance. And then for specialists, you have to pay a 40% coinsurance. But if it says coinsurance on here, that means that you still have to pay into the deductible first. So you still have to pay $5,000 into those $5,000. So whatever full price the specialist visit is, you have to pay that before the 40% discount kicks in, right? Where you're only paying that 40%. The other problem with this is that look at the cost of the medication. If Sarah were on an anxiety medication that's a tier 1, on this bronze plan, she would have to make sure that she is accounting for $45 a month for her medication. If, however, she were to choose a silver plan, that might be a little bit more expensive. And I wonder where I got that 21 because now I don't see it. I think it might have been with a different amount or income. But as we look at this plan, the deductible is already lower. It's $100. And then when we look at the summary of benefits, primary care for injury or illness is actually no charge at all times, which is amazing. Specialty care is guaranteed at a copay in this one, which is $40. The coinsurance rate is a lot lower. And sorry, I think somebody came off mute.
Yeah, is there a difference between coinsurance and copay?
Yes, that's a good question. So coinsurance is essentially health insurance works in phases. You pay into the deductible, which is any of the services that are listed, which is why it's very important for people to understand your summary of benefits. So this might even be an education time for you. So I urge you all to, if you do have private insurance, to go to your summary of benefits after this, to kind of look at this and say, okay, so your deductible is you have to pay for any type of service that's like a lab, a specialty care, or anything that's on your summary of benefits listed as a coinsurance. You have to pay into the deductible first. So that means that anything that is charged as a coinsurance is going to be charged full price until you've paid into the $100 of your deductible. Does that make sense? That is, okay, so that's your deductible phase. Once you've paid into that, then you can see that discounted rate of whatever is on your plan. In this case, it's 20% for anything that is charged as coinsurance. So if you were going to get blood work and it was $100, you're only paying $20 for that visit after you've paid into the $100, right? Assuming you paid your deductible. A copay is a number that you always see on here. A copay is a set price.
Okay.
And so you have to look at your summary of benefits to really know what you're going to expect for any of the services that you might request. So if you're looking for medications, this is the difference between the silver and the bronze plan. This bronze plan has a $45 copay for generic medications for tier 1, whereas this silver plan has a $20 copay. Makes a big difference for somebody who's living paycheck to paycheck, right? So just
Yeah.
kind of knowing the differences is very important. And so that's the beauty of the work that we do, is that we actually take the time to walk through the application with the client, educate them on what they're eligible for or what they might be eligible for. And then once they've selected the plans, or even just comparing the plans, as I'm doing with you all, of comparing Sarah's different options, is really understanding what is the better option for you, dependent on your prescription needs, dependent on your provider needs, your specialty needs. If there is anything else that we need to budget for, then we want to make sure that we're accounting for it on here as we're looking at your summary of benefits, right? And then in hopes that we provided enough information for you to compare the different plans, then you now have enough information to actually select a plan, because we are just navigators and educators. We cannot sell anything to a client. We're not a broker. And so we're really making sure that we just really educate people on how to budget their healthcare and really consider everything of their healthcare. Like with Sarah, I think one of the most important things about the story is knowing that she needs access to mental health, right? That's like the biggest priority for her at this point. And so just really making sure that we ask those questions. Why does Colorado allow bronze plans when it seems they are not really protective insurance but Hail Marys? Yeah, that's a great question. Because I believe that by law, through the Affordable Care Act, the minimum coverage is at least having a bronze plan. And so the biggest way for them to cover that somebody has been covered through insurance, and this is especially like most important so that employers could then provide health insurance to their employees, is that they're at least providing a bronze plan. The key here to also understand why we're able to get away with what we say that is the best system, at least some people might argue that it is that exactly a way to shrink responsibility. The one way that the Affordable Care Act puts it is that there are 10 essential benefits that you must receive in any of the plans that you have, regardless of whether it's on the marketplace or it's from your employer. You need to have that minimum essential coverage, and that minimum essential coverage, unfortunately, is a bronze plan. So long as it provides that preventative care for free, and you're able to get away with, saying, okay, well, at least they have preventative care. Who cares if they have a bronze plan? Let's just hope that they're very healthy. That's one way of looking at it, right? Is the government is saying, well, we're at least making sure that they get the benefits that they need. How do they pay for them? That's on the patient themselves, right? That's on the consumer. That's a good
So
question.
So, um, are these under the same deadlines as the Obamacare plans so that, like, if somebody comes in your office and they don't have insurance, when do you offer these plans? Is it only if they have a event like moving to a new job, or do you do these only like do you do most of it during the eligibility period, or what happens to the people that come into your office? How often do you do this?
Thank you so much for asking that question, Kathy. I really appreciate that. You can see on the screen here, Connect for Health has done a great job of updating their website to kind of show when people can get health insurance. As you saw in here, open enrollment unfortunately has been closed. So it goes from November 1st to January 15th, and it could potentially be reducing to December 31st, come this new open enrollment season. So stay tuned. Um, but if somebody has to sign up outside of open enrollment, our services are available all year round for folks. Because not only do we help people apply for private insurance through the Obamacare or Connect for Health, however you recognize it, we also help with Medicaid and CHP. And you can apply for Medicaid and CHP at any time of the year. There's no need for a special enrollment period. Um, you just have to make sure that you qualify at that moment based on your income. So Kathy kind of alluded to this. So we help educate the community, and what we do during this special enrollment period is go out and educate the community. And you all are great advocates, and I know you can go out into the community and educate people on this. So please, if this comes up for you, please share it with the community. I think it's always great for people to know about this. Qualifying events are big, and so you can buy health insurance if you experience changes like losing your job's health insurance, losing Medicaid, changes in your income, moving, getting married, and having a baby. And actually, now, starting last year, you are now able to actually report the moment that somebody declares that you are a medical provider it finds that you are pregnant. Then at that point, with the proof of pregnancy, you can actually also report that as a life change event. Um, and so these make you eligible for a 60-day special enrollment period. And for really an understanding of what event might qualify, it's always best to just give us a call to also make sure that we can also just verify that it is a right life change event. And we'll always screen people before we even book them for an appointment to make sure that they're eligible before wasting their time as well. Um, Tax time enrollment is a huge one right now. So if people are filing their taxes, there is a box in their taxes where they can check off, and I'll show you here. So it's literally a little question of to see if you or members of your household qualify for free or reduced health coverage. Check this box. Um, and then this is only if you don't have health insurance at the moment. And so at that point, you would then get a letter sent to you, or an email or letter that you'll receive from Connect for Health saying that you now qualify for a special enrollment period. And then you would use that to apply. But if in the moment that somebody just doesn't really know exactly how to navigate that and how to report that change, then they can then call us and just say, hey, I got a letter from Connect for Health about the tax time enrollment. Can you help me out? Again, Health First Colorado or CHP Plus programs are available all year round, just so long as people meet those needs, and we are able to help all year round. Native Americans are able to apply once a month for different coverage options, depending on their income.
Can we
Thank you
get
for
back
that
to
question.
Sarah for a minute? And how many people won't even pay the $20? Like, I mean, just say they don't want health insurance because it's too expensive, even with the dollar's not worth it to them.
Yeah, I think this happens a lot more often than people think. It's just um, it's so hard to get people out of the mentality of thinking that, it's hard to stretch that paycheck, right? And for them, it's like an emergency is going to come up for my child a lot more often than I'm going to need health care. So I'd rather sacrifice my health care and prioritize my child's needs more than anything. And that happens a lot, especially in low income families. And people like Sarah constantly have to make this decision of like, oh, can I take this job? Or the other concern for Sarah could be that we talked about her and we talked about her transition to from Medicaid to private insurance. But for a lot of folks, the conversation is also about their children. Of now I've earned too much income. My child that was on Medicaid and my child, like her son, has asthma, and then her daughter, age 13, is struggling with situational depression and is better when she sees a counselor twice a month. The benefits for behavioral health change between even just between Medicaid and CHP. So even for her to decide, oh, my child's benefits are going to change if I take this job, then even that is an impact, right? Of I would rather her be able to have access to mental health benefits than me because my daughter is the priority.
So what are the Medicaid benefits for behavioral health for kids?
So I think the cool thing about Medicaid benefits in general is that they're just so ample. Is essentially healthcare is free under Medicaid, for the most part, right? Um, one really cool thing about the behavioral, look at that. No copays, no copays. This is their summary of benefits. Of course, it has its limitations. One visit to a provider for the issue per day. It's not something extreme. Um, dental services are included for the children. Dental services are not included for Sarah. So Sarah actually also should consider dental benefits. And dental benefits are not included in her private insurance plan either. So she would have to also add that. Emergency room care, ambulance services, all of this is included on here. There's not too much limitation.
Hmm.
And then let's see.
So a big part of um her um her expense or her funds for other expenses comes from the golden ticket. So how likely is that? You said it's pretty unlikely, but like how many people get that? And she would have to
Mhm.
know that at the beginning of the year, really, you know?
Yeah, exactly. Yeah. So housing vouchers are nearly impossible nowadays. Just given the housing crisis that's going on in the state of Colorado and specifically in the Denver metro area, it's very expensive. And so that is actually something that can just like it genuinely is a golden ticket. And so for her to have that is it would just give her like the financial mobility to even potentially start saving up for a home, right? Like this is thinking about further from just making sure that that person has access to healthcare in that moment in this year. This is thinking a little bit forward, right? And you can see how like even at even just having making sure that she has no other outcomes where nothing is bad and it is what it is, or having like additional help, um she's still really tight. Like there's like it's just she's hoping that she has some money to save, but even then it's really an emergency savings. It's not to be able to build anything in the future.
How
And
how long could you count on that? I mean,
right, exactly. How long can she count on that? How long can we rely on rent staying at 1,500 because inflation happens and then the next year that comes, right? And then the tax credits get cut even more, you know?
mhm. What's the difference between the housing credit and Section 8 housing?
So the housing, it would essentially be the same thing. I think that the housing vouchers, Section 8 is different in the sense that you have to have a form of a disability to be able to apply for those programs. And even then, there's definitely lines for those programs as well. Whereas for like a voucher for reduced housing that was offered for an income-based program, a local income-based program, that could be completely different. That could just be because they had funding for that. And that was, the eligibility, the criteria was just being within certain income limits. And those happen a lot. But it's just finding those little pockets is, you got to make sure you have a resource. And unfortunately, a resource like us that helps us, navigate other parts of that person's healthcare, I think is really important. So I think the uniqueness also about our clinic is also that we acknowledge that a person's ability to access healthcare is not just on their private insurance. It's also on whether they have access to transportation, access to housing, access to education. All of those things really do come together to really hold that person up to have the best healthcare that they can. And really
So,
acknowledging that is very important.
so do you help them connect with other programs or
Absolutely. Yeah. So specifically with the clinic, I think the beautiful thing about the clinic is that we also have a behavioral health advocate, which will offer navigation services. So our coverage program will navigate health insurance and healthcare options. And then our behavioral health advocate will, do screenings with the clinic patients. And if the screening shows that they need housing resources, that they need, additional specialized behavioral health that we can't provide in the clinic, like psychiatry or anything like that. Um, we can also provide information on food resources. We also help with SNAP applications. So having those additional things, additional resources, you know, make that potential for Sarah to make the better option because we're all cheering her on, right? To choose the silver plan so that she has better access to healthcare. But in her mind, she really wants to save money so that she has
Mhm.
that emergency fund, right?
Right. So would she qualify for SNAP at her income level?
Unfortunately, she would not. She would, because she would take on that job and her income would increase. She would lose her SNAP benefits.
That's a big decision.
That is a big decision. Yeah. So she would lose those SNAP benefits that would then make groceries extremely expensive, right? Somebody asked in the chat, I'm also checking the chat one sec. Um,
I understand Colorado's Medicaid system, statewide health care is incredibly financially
mhm.
stressed given federal cuts. What's the best outcome to expect for the next year, do you think?
It's a great question. I don't know if there's a good outcome. I think that the best outcome is that people find safety net resources that are available to them because I think that the best education that we need to provide this year is really on preventative care. Because as we see these federal cuts happen, you might have noticed um, that they're cutting access points. So they're cutting access to people who have legal permanent residence under 5 years. They're cutting people who have asylum, cutting people who might have, not been part of the expansion had the expansion not happened, right? So cutting all of those people off of healthcare is their way of supposedly, finding more money. Um, and so with that, you're going to start to see an increment in uninsured rates of all those people that were initially covered under the Obamacare that will no longer be covered. And what happens when somebody doesn't have health insurance? You don't have a primary care home. And when you don't have a primary care home, where do you go? Emergency room, the emergency room. And when you go to the emergency room for a migraine, you're going to be taken to an MRI where you will be charged $3,000, possibly, or more, um, for something that you might not even qualify for getting any assistance for because it wasn't an emergency, right? Because it was a migraine and it was something that should have been attended at an urgent care or at a primary care provider. So now all of these hospitals are left with all these big bills that they can't bill anyone for because they are uninsurable. And therefore, we can't even get them to cover the most minimum cover, right? Like the emergencies, because they're also not emergencies. So, emergency Medicaid only covers life-threatening. And so now hospitals are having to take on all of that uncompensated care. So I don't think that I don't know what the best outcome could be, but I can tell you what some of the worst outcomes could be is that hospitals are going to start closing down. Um, you're going to start seeing a lot more people just looking for primary care and they just can't find it, right? Um, I think somebody had asked if we are a federally qualified health center, and we are not. So federally qualified health centers take people who have Medicaid, but they are actually reimbursed at a federal rate for accepting Medicaid. As a safety net clinic, we do accept Medicaid patients and CHP, but we don't get reimbursed at that rate because we don't have certain requirements that we have to fulfill. And so, as a safety net, we just accept everything basically. And if you're uninsured, that's probably the population that we see the most. Um, and so that's the difference between us and a federally qualified health center is that we don't follow the federal regulations that they have for those clinics. And so what you're also probably going to see is those people that fall off of Medicaid that go to federally qualified health centers will then no longer be able to go to those clinics because they lost their Medicaid. And those clinics will be limited to only accepting Medicaid folks because they need to make sure that they're still getting paid. And so all of those uninsured folks are going to come to our clinic. Does that make sense?
It does
It's
make
a,
sense,
it's a
but
domino effect.
you only serve Douglas and Arapahoe County. Do you have affiliates in other counties? What about the rest of
So
Colorado?
I want to, yeah. So we primarily serve those counties, but we're not limited to a county. So, we're part of a bigger, a broader what's called the Colorado Safety Net Collaborative, where we can connect them to other safety net clinics that might be able to offer services. And somebody also asked, how you can reach out to us. This is the clinic number. And then I'll put the coverage number on here as well if you guys are interested or have any questions for our services, our direct services, because I know we're running out of time. Um,
Do you know,
but
do you
go
know
ahead.
if that system covers all of Colorado, or there's are some people that are just left out?
Yeah, so I know that there's definitely some federally qualified health centers that are like in more rural areas. But there are safety net clinics that are in rural areas. Um, if somebody is coming from Adams County all the way to our clinic, we're more than happy to take them. If it really is like, if you can come to our clinic, we will take you because we know that a lot of clinics are limited geographically, and we are not because of that same reason that, access is very limited. I mean, in Douglas County, we are the only safety net clinic that is available. Um, and so, yeah, the sources are very limited at this point.
Yeah. Does anybody else have any questions? We're coming to the end of the time. I just want to give everybody a chance to ask whatever questions you might have. This has been really interesting. I think we got a lot of good information, and we can really realize how difficult these decisions are and what people are going through in our own state of Colorado. Um, and it's becoming even more difficult. So thank you, Laura Elena. We really appreciate it. Anybody else have any
Thank
questions?
you
Go
all.
ahead and ask. Just unmute.
I had a quick question.
Yeah,
Go
go
ahead,
ahead.
Cheryl.
You mentioned that you said the hospitals might eventually close if they have to not, or not get paid. what does the state have to pay for in an emergency room visit versus what the hospital has to cover?
Yeah, so that's a good question. So when it comes to, well, it really depends on who's coming into the emergency room, right? So if it's a Medicaid patient coming into the room, then the reimbursement rate is dependent on that person. If that person has Medicaid, then the government's going to pay that portion of the care for that person that has Medicaid and used it for an emergency. They're going to cover that. If it's somebody who was uninsured, that just becomes part of that hospital's uninsured, uncompensated care. And so that's just charity care. That's just money that's just being, you know, thrown away, just gone. Not necessarily thrown away because it's still providing care, but it's money that is not accounted for.
So
Oh,
does the
yeah,
state Medicaid, go ahead, sorry. Go ahead.
I thought that the state, that's why the state wanted to cover a lot of people, because if they go to the
Yeah.
emergency room, then it's billed to the state and it's a lot more expensive. But you're saying it doesn't really get billed to the state for uninsured people. That's
Not for
just a loss
uninsured
for the
folks.
hospital.
Exactly. For folks who lose coverage, that's just that becomes uncompensated care. And so the problem too is now that states are deciding, or sorry, now that the federal government is deciding, hey, you can't even provide expansion programs in your state because your expansion programs are providing coverage to undocumented folks and to folks who should not have coverage, which is true. Cover All Coloradans is a program here in the state of Colorado that is providing coverage to undocumented children. But it's doing that to prevent what is going to happen, right? What we were just talking about is if we get those folks covered under Medicaid, then at least we can reimburse for their care because they are accessing care. And we know that because we've tested it with Cover All Coloradans and we have data to show that they are indeed accessing care. That program is also being not fully gutted, but that program is being cut to where there are limitations to how much spending each patient gets, unfortunately, now on Cover All Coloradans.
And isn't it a federal mandate for all the states that anybody that walks into an emergency room, they don't have coverage or insurance, the hospital has to provide service for them?
Exactly. That is correct.
Does that matter if it's deemed an emergency or not deemed an emergency?
I believe that if it's deemed an emergency, that's where it's like you have to provide that care. And it just gets tricky because like once you step into the emergency room, it's like, and if you say you're having chest pain and it's really reflux, but you don't know how to explain that, they're gonna think it's chest pain. So for them, it's emergency care, and so they're taking you in at that point, right? So
Yeah.
that's where that education really comes into play of really, again, thank you for asking how you can share our resources because that's really where we come into play is educating people on, hey, come to us for primary care. Come to us for if you're sick. If you're feeling that, you don't feel good, but you're also asking yourself if it's an emergency, it's not an emergency. Go to your primary care provider. Things like that can really help educate people and really teach them that stepping into the emergency room has repercussions, unfortunately, right?
Yeah. Anybody else have any questions? Well, Laura Elena, thank you so much. You really did give us a lot of information. I know a lot of
Thank
people are
you.
going to watch the video, and we really appreciate all your expertise. So thank you
Thank you
for all
all.
the work you're doing in the community, which
Thank you so
is
much.
actually critical. So thank you.
Mhm.
Take care.
Thank you.